My name is Drake Collins. I am an HIV prevention specialist. I do health education work, particularly around sex education, and I do Prep Navigation, and I have been on PrEP myself for the last 7 years. I grew up in the I grew up in the 80s and the 90s. I graduated high school in 97, so I graduated just a year after the first protease inhibitors came out. So for me, when I grew up, sex was kind of always linked with HIV and fear and all of those kinds of things. And I think for a lot of folks, that's even now, that's still that way, who don't know what the situation is around HIV. But these days, it's a lot easier, and especially working in the field, knowing all the stuff that I know, it's helped a lot, and PrEP has been a big contributor to making those things easier, and helping to take the fear and things like that out of sex that we had to deal with for a very long time. For the longest time, the only prevention that we had around HIV was basically, education and condoms and abstinence, and that was it. Those were your options. And then eventually we got PEP, which is post-exposure prophylaxis, and then now we have PrEP, which is pre-exposure prophylaxis, and it really has given us, instead of just one option, we now have sort of this bigger prevention toolbox that we can use, and that meets everybody's different needs based on where they are. So I have actually been on PrEP myself for the last 7 years. It's been available for 10, and I knew about it and everything, but I wanted to sort of see, I didn't know enough about how well it worked and side effects and all those kinds of things. So I had a number of friends who had started on it pretty quickly, and so I waited to talk to them about what their experiences were, and that's when I decided to get onto it as well, just because, for me, I still like condoms, but condoms are still not under my control. I have to negotiate those with a person. So, not just the discussion, but then there's also the, is it actually staying on and things like that. And I did at least once catch somebody taking it off and trying to not use one, despite having talked about using it. So that was, I think, for me, the biggest, the last thing that was like, I need to actually look at this. And what I really like about PrEP is that it is entirely under my control. We also have, U equals U as a prevention, which is fantastic, but I don't have any control over whether or not another person is taking their medication or not. I do control if I've taken mine, and I know if I've taken it or not. And so for me, that's why, I still am using condoms and things, but I look at condoms as my sort of second line of defense, and I look at PrEP as my primary prevention as far as HIV goes. So if you would like to start PrEP, really the best thing to do is to talk to your doctor, your primary care doctor that you see on a regular basis. If that's somebody that you're not comfortable talking to about those kinds of things, about your sexual activity and stuff like that, or substance use, if you're injecting substances, because it does work for that as well, then there are other providers that are happy to help. Where I work does, there are other ASOs in the area that all provide navigation, and we can all link you in to care. For people who are interested in PEP, who've just had a recent exposure within the last 3 days, the best thing you can do is go to your emergency room. All emergency rooms should know how to prescribe PEP and get you access as quickly as possible.